Hello and good day. My name is Dee Deshawn and I'm a member of the League of Women Voters of the Ann Arbor area. We serve all of Washtenaw County. I will be your moderator today for our monthly Lunch and Learn session. Before I introduce our speakers today, here's a bit about the League of Women Voters. We are a nonpartisan civic organization that encourages informed and active participation by all citizens. The League works to increase understanding of major public policy issues and seeks to strengthen and broaden knowledge about our form of government and democracy. While the League does not support candidates or parties, we do take stands on issues we have studied. Our advocacy committee plays an important role in helping us determine what topics we want to educate citizens about. Thus, the issue of healthcare, notably the state of Michigan's COVID-19 response, is our topic today. Let me introduce our presenters today. Robin Erb and Mike Wilkinson, reporters from Bridge Magazine Online, Bridge Michigan, I should say, online, have been covering COVID matters since the pandemic began. Today on Lunch and Learn, they will discuss their findings about progress in the state of Michigan's COVID response efforts. If you're not familiar with Bridge Michigan Online magazine, personally, I would suggest you check it out. What they say about themselves is they are a nonprofit, nonpartisan news organization that provides fact-driven journalism on the state's diverse people, politics, and economy. Bridge Michigan serves as a watchdog on the biggest issues impacting Michiganders' daily lives, giving unique, insightful coverage by questioning those in power, demanding answers, and analyzing complex problems so readers can draw their own conclusions and bridge a path to a better Michigan. These particular reporters are here because I asked them to be here because of how powerful I think the nonpartisan news is from Bridge Magazine. So without further ado, Robin leads health coverage for Michigan Health Watch for Bridge Michigan. An award-winning journalist, Robin believes our personal stories keep us connected on common ground. In doing so, she has chronicled both the misery caused by the COVID-19 as well as the triumphs. Wherever the story, in hospitals, nursing homes, kitchen tables, job sites, Robin believes it's our personal stories that keep us connected and moving forward. A longtime journalist, Robin previously spent 6 years at the Detroit Free Press, chronicling the fight against and sometimes the triumph over our most horrific diseases. Mike Wilkinson is also a reporter at Bridge Michigan, but he focuses on the data analysis in his reporting. As a data analyst, he has worked on coronavirus data from the earliest days of the pandemic, creating maps, charts, and writing analysis to help make sense of how Michigan and places within Michigan have fared. So Robin and Mike, welcome to you both in the League of Women Voters of the Ann Arbor area. Robin, take it away.
Thanks so much for having us. It's really nice to be here. I was thinking last night as I was finishing up some slides for today's presentation, and there's not a lot of slides, so we're not going to inundate you. But there were 3 realizations that I had yesterday while I was getting ready, and one was that 1 year ago Sunday, so 1 year ago in 2 days, I drove up to Lansing, and I live just south of Ann Arbor. I think most of you are in the Ann Arbor area, right? And I drove up to Lansing for the opening of the Emergency Response Center, the governor's opening of that. And it was the first time we were hearing things like, stop shaking hands, use elbow bumps. And, you know, this is long before masking. This is long before, a few weeks before we had our first case of COVID in Michigan. And I remember Dr. Caldoun, our state medical executive, saying that we may not have enough supplies for this year. And I thought at the time, and I nearly didn't write a story thinking, can that possibly be? Can life change really that much that we're not going to shake hands, that we might have healthcare overwhelmed? And that was just a year ago. And so it's been, as we all know, it's just been a crazy year. And Mike and I have been chronicling what's been happening here in Michigan. The other realization, my second realization, is just how long Mike and I have known each other. And we were just talking before this. We started working together in '94 in Toledo, Ohio. We ended up going, Mike went to the Detroit News for several years. I went to the Detroit Free Press, as Dee said, for several years. And now we're both here at Bridge. And this year we've ended up working a lot together because Mike is our data guru, our data genius, and he helps keep us all honest and knowing what really is going on in Michigan. And my third realization really is just in all of this time in reporting how much I love working for Bridge for things like this today. You know, we're able to engage with readers and engage with people when we're not on some kind of frenetic deadline, and we can hear what's on your minds. And so I say that because at the end of this presentation, you'll have our contact information, and we both very much want to hear from you. And I mean that sincerely. Please take that information down, and I think you'll have the slides and the recording. Reach out anytime. And I'm going to pull up my slides here. The other thing I will say is I like books instead of tablets because I know exactly what my commitment is for for how much I have to read. And I'm going to tell you right now, we have 10 slides today. And so we're going to talk to you a little bit about how we've been covering this and what to expect in Michigan coming forward. So right there, that's Mike and I, and he's going to take this away in a minute, but we're going to throw you some slides just to talk a little bit about, again, what we've been doing this year. And if I can make my computer work here for me. All right, and now you're all looking at some headlines, right? So again, it's been a crazy year, as we all know, and so much has you know, there's a constant information that comes in from readers and from public officials about what's going on. Phone calls, emails, texts, the messages again from elected leaders, people who, you know, messages from public health and messages from people who don't believe in public health or distrust or critical of public health. And so the data all along has really helped us understand, again, what's been happening in Michigan. And you can see here that we've used data, and Mike especially, he's just been the backbone of our data reporting all along in terms of understanding not only what's happening, you know, in healthcare, but also in schools and nursing homes, and now the vaccine distribution. And again, we look to data because it's easy to write about anecdotes, and we all have our own individual reality, but it gives us a greater context. So you can see, you know, all along, we've really been trying to tell you or tell readers what's really been going on on the ground. As an example, from the very get-go, I have been interested in for many years. I've written about what's happening, healthy aging in Michigan. And from the very get-go, before the first case was discovered in or confirmed in one of our nursing homes, we were writing at Bridge about how this pandemic could play out for seniors, for example, whether they were in nursing homes, assisted living facilities, or even in their own homes. And it wasn't just about the virus itself and a possible infection. It was about the isolation that might come. It was about being cut off from services. It was about being cut off from families and friends, from kind of everyday life. And so we wrote that story, and we wondered what was happening as the pandemic picked up. And we did, you know, it wasn't just us. We had other reporters in the state asking the state what's going on in long-term care. And that data finally came out, and we know this now, but we didn't at the time. We knew how awful this was going to be in long-term care. And Mike he probably has the numbers right off the top of his head on just how deadly this has been. Of the 15,000 plus deaths in Michigan, how deadly this has been in long-term care. And it's, you know, but the data only, you know, the data are data points. And so we also wanted to make sure we were telling the human story. So we've also been talking to people, you know, the ones who are on the other side of those windows, inside long-term care. We've been talking to the folks standing outside those windows. We've been talking to administrators. We've been talking to policymakers. And the long and short of it is, these are impossible decisions in long-term care, but we've been reporting from the data because it does tell us exactly what's going on. Mike can talk more about this, and Mike, you could jump in if you want on this slide. You know, we wondered how coronavirus obviously was causing problems in school. On the other hand, or we didn't know exactly what the problems were that it was causing. On the other hand, trying to balance out infection, you're really trying to keep kids educated and engaged and socially active and all of those things. So it was the data that helped us understand what was happening in schools. And it's data, and not just us, data helps us understand when to open those schools. And Mike can talk a little more about this. I don't know if you want to talk about that now, Mike, or you want to wait?
Let me talk a little bit about the data. I mean, one thing that was really fascinating, and thank you for having us. I'm very grateful I will talk about the coronavirus data at any time. And sometimes it's really boring, but sometimes it is revelatory. And it kind of works hand in hand with some of the great stories Robin has done, where she gets on the phone with the person whose husband is behind the window, as she mentioned, and it is isolated. So, but the data in the very beginning didn't exist. But one of the reasons we knew that there was a very looming problem was obviously it came to the United States and first hit Washington and hit a nursing home. I had just returned from a vacation in Italy, which obviously, as we all know now, was one of the first really horribly hit countries. And as I was reading the stories, I knew that the median age there was actually 80 years old. In Michigan, it's 77, not much younger, but it is. So we knew to look for it. I mean, when the first cases started showing up and the first deaths started showing up, there were reports on TV and in print media about a nursing home death here or there. And that's when you kind of, without the full measure of the data, you're able to combine your own experiences in terms of what you knew was going on elsewhere and what was likely to happen in Michigan. And frankly, the data was not very good in Michigan. And we had to fight, we had to write stories. We wrote them several times, criticizing the state for not having sufficient data so that we could really understand what was going on. Ultimately, it did yield better data. And we were able to find out that in skilled nursing homes alone, in the first 3 or 4 months, there were 37% of all deaths in the state were there. Currently, it's 37%, including nursing homes and homes for the aged and adult foster care. It's a broader universe, so they've done a better job with the nursing home. But the data at first was not there. But once we saw it, we were able to kind of lend the heft of what was going on into that particular area of the story. But a lot of times with the data, if you watch it every day, and maybe people are ones that do that, because we do have a lot of people that do, it kind of reveals what's a broader trend, and even before the state is willing to kind of talk about it. I cover every day. I do the tracker, and I download 5 spreadsheets and I analyze them, and they get put up into our dashboard. And I kind of noticed the second wave was one crushing the Upper Peninsula. And then it kind of bled down into the rest of the state. And the state didn't want to call it a second wave. They kind of said, well, maybe. And then finally, like a week later, it was so clear that we were in the second wave. But the data really did kind of make that clear that was happening. And another story I wrote this week was about nursing homes and the number of cases that have fallen there. It's just unbelievable since the beginning of the vaccine program. Nursing home cases have fallen 90%. Now, statewide cases have fallen 63%, but that gap is clearly attributed to vaccines. And the state didn't want to say it, but now we're seeing stories all across the country from the New York Times, Washington Post, kind of pointing out exactly that the vaccines are working, they're effective, and they're really already saving cases and most likely, obviously, lives. So that's a little bit what I want to talk about. I'll throw it back to Rob. About schools. We had to fight the state, as a number of organizations did, to try to get data about school outbreaks. They didn't want to do that, and they do now. But again, you had to fight the state. The state has not been the greatest and the most transparent, but it has come around and does provide us with the sufficient information that we can help you all know where we are, where do we compare with Ohio and Indiana, North Dakota. So we are doing better. Kick it back to you, Robin.
Yeah, Mike and a number of reporters in the state have really been pushing for better data. And it is incredible. And I'm going to show you a slide in a minute. The state does put out lots of data every day. And if you don't already look at that, it's fascinating. And Mike's done a great job at making that really user-friendly on our site. I'll show you that in a minute. But props to a lot of reporters who really pressed the state on making sure this data was released. It's far from perfect. I think I get a call from Mike at least once a week saying, this is messed up. You know, the state's data is missing something or it doesn't make sense. But, you know, everybody's scrambling to make this work. And so it's been interesting watching the state let go of this data, and it hasn't been sometimes without a fight. So that brings us to what's happening now and what is on everybody's mind. I guess I challenge anybody to think of the last time they had a day where they didn't talk or think about the vaccine distribution right now. Right away, we knew it was, right away it was apparent that this was going to be, I don't want to say a free-for-all, it's not that bad, but certainly confusion. And we've documented just the frustration of people trying to deal with websites and phone call centers and waiting lists and trying to get that vaccine. And, you know, the state, I think, has stumbled in some things, but that being said, the biggest problem is we just don't have enough supply. That's what we were hearing early on, but you kind of wonder, is that really what's happening? But when we looked at the data, again, when Mike mostly looked at the data, you can track where there's very few, the small supply was going compared to where the demand was coming from. So we hear you, and we've been writing a lot about the frustrations in getting vaccines. Mike just told me yesterday that you can see that the pace certainly is picking up. I think, Mike, you said that it took like 48 days to get the first 1 million doses. And then about half that time to get to the second 1 million doses. So that's great, but there's still, there's still a lot of frustration as the vaccines are going out. And yesterday we had a discussion, one of the next groups to be eligible for this. One of the next groups are folks with disabilities or comorbidities, underlying health conditions. And it'll be interesting to see how that distribution goes. So you may know the Johnson & Johnson vaccine may be approved as early as today, or authorized as early as today. So that may relieve some of the bottleneck or some of the supply problem. But I don't think anyone's going to make predictions right now where it's going. But in the meantime, we are watching those numbers, and it's been interesting to follow the vaccine distribution.
One thing I want to say something about the vaccine, and I'm sure most of the people here are probably either have gotten it or attempted to get it. It is a limited resource, obviously, and there's been trouble most everywhere. Washtenaw County happens to be one of the areas with one of the highest per capita rates of vaccination. Probably a lot of that has to do with the number of vaccines that were at first given to Michigan Medicine at U of M and the healthcare facility there. But as angry and or anxious as everyone is, if we do get 4 million vaccine doses over the next 5 weeks, we are going to be in such a better place. And Michigan at one point was 42nd, 43rd in terms of the rate of getting doses into people's arms. It rose as high as 20th, and now it is sliding. It's down to like 36 now. But and I've written this recently. It sounds like we're really backsliding. What's really happening is the whole country is moving forward at about the same time. So if we're 37th, we are so close to the states that are 36th and 35th and 34th and 33rd. That doesn't minimize the anxiety that people have who are trying to get the vaccine. But I think, as one of my editors and I talk about is, I think in 3 weeks, a lot of us are going to go, wow, that went a lot faster than I thought it was going to, which I guess is positive. And I guess since we've all basically waited 9-10 months now to do much, what is another 3 weeks or 4 weeks? But Robin has done a great job of telling the human stories about the people trying to, you're on the internet, you're making 10 calls. A gentleman just told me yesterday, he lives in Livingston County. Every day he was trying to find a place. He had to go to a pharmacy in DeWitt, which is quite a ways from where he is, to get a vaccine, but he hasn't. So he's excited about that now. I'm sure you have a lot of questions about the vaccine, and I don't have it, but I'm in an age group that I can probably expect, but I expect to get it by the end of April. I'm pretty confident that'll happen.
And it's interesting. Mike lives in Ohio, right across the state line. I live just a few minutes. I'm not supposed to tell you that.
No,
Mike has relatives in Ohio.
Yeah.
And I live right down by the state line as well. And it's been interesting. You can see the difference is in the way the ease of access in Ohio, or at least the, there seems to be one central website to find vaccines. Doesn't mean you're not going to have to wait, but at least there seems to be one centralized place for information. And that hasn't been the case as much in Michigan. Now, I will say, and we posted a story on this yesterday, there's a federal website now that will help you find at least the providers in your area. It doesn't help you schedule. It doesn't shorten the wait per se, but at least helps you know exactly who's around, whether it's a pharmacy, the local health department, a retail store, exactly who has those vaccines. And that story we posted yesterday. So I'll be curious if anyone hasn't had their vaccine yet. I'd be curious to see how that works for you. So again, you'll have my information afterwards. Feel free to reach out. The one thing we really try to do at Bridge is, and I think most media outlets try and do this more these days, is to be more to offer customer service in terms of beyond news and beyond what's happening, but exactly how can you make the system work, or how can you make life work for you every day. The data has helped us with that as well this year. I remember before Thanksgiving, my kids were coming home for Thanksgiving and they couldn't get a COVID test. And we were hearing from people they couldn't get a COVID test. So the question was, well, are they not doing it right? Are they not asking the right people? Are they not going to the right places? But the data showed us just this giant demand on COVID tests right before everybody was coming home for Thanksgiving. And so we tried to put it in perspective for people. It's not you. It's crazy out there. Now, Mike can probably talk about this. The wait for tests isn't nearly like that now. In fact, I don't know if most places even have a wait. Do they, Mike, or do you know?
I've not heard anyone complain about it. The state has here's one props to the state. The expansion of testing was one of the great successes. We were one of the first states to sufficiently test. I'll mention this later. Very early on, we were one of when we had 40% of people testing positive, that just revealed that there were just so many more cases. But right now, if you need a test, it should not be a problem. And I think you're going to get the results back in under 2 days, which is fantastic as we go forward, because the positive rate has gone down so much. In terms of identifying future outbreaks, we should be able to identify them fairly quickly.
Some of the other things we've tried to do are, and you can see the headlines there, again, how do I get the vaccine? We've been trying to help people offer tips on that. And I've taken a number of calls myself. I will tell you very quickly, I had a woman call me last week and she says, look, I just can't work the internet as well as other people. I can't find a vaccine. So I said, well, obviously I can't sign you up, but let me just very quickly, I'll at least find you a phone number for you to call. And so I thought, well, this was going to be a 3-minute job. And I have to tell you, I worked on it for about an hour and I never did find her a phone number that was in an area that, she was capable of getting to. And it really was astonishing for me, because I think sometimes I take it for granted that, you can hit your mobile phone and find something, and not everybody can do that. So I'll tell you, after all these years in reporting, every day I learn something new, or every day I'm reminded of something. And that was one of those things last week, that it's still not easy if you don't work a mobile phone like Mike and I do.
Well, and I want to say
the other thing is, Mike. Oh, go ahead.
No, I was going to say about working the internet. Some counties, and I don't think Washington is one, have decided not to allow online appointment scheduling, because it kind of skews the playing field into those who are able. And as an equity issue, which I'm not sure we're going to talk about, but equity has been a big topic lately. There are some counties who are like, no, you got to call like everyone else, because you're giving such an advantage to the people who can schedule an appointment via the internet. My mom never would have been able to figure it out. My wife spent 10 minutes and found one, but and that was in Ohio. So it is interesting that there are places that are still doing it. It is easier for those places, but it's also harder for a large segment of the population who most need it.
Yeah. my folks would not have been able to get the vaccine as quickly as they did without somebody from the hospital calling them. That's for certain. And Mike also took, if you see the last headline there, Mike and I looked at, we've been watching the state, the My Start map, My Safe Start. Did I say it? My Start, right, Mike? The My Start map.
It all sounds good.
I know, we look at it every day and I can't remember what it's called, but and this is the map for the state that shows the risk levels for COVID spread in those counties, and then of course in the region. And what we found is, a lot of these long-term care facilities were saying we can't open because of the pandemic orders, and that's true for a lot of them. But there were also a lot of counties where they could have opened, but those nursing homes did not, because they were worried about COVID spread. So, we've done a couple of stories just talking about, all right, so how do we make this work? And we didn't put it here, but there were stories about how nursing homes are trying to find workarounds around the pandemic order to help engage families. And then we even talked about what are some of the policy changes that could happen to make visitation easier and keep people safe. So all of that is to say, we really do try to, give you news that helps us live better every day. And finally, and I'll turn this over to Mike. He if you saw the coding he does behind the scenes, the computer coding and all the magic behind the scenes, I'm sure a lot of you would be wowed. I still don't understand it. But Mike every day takes the state data that is released at 3 o'clock and does our own dashboard. And you'll find it, if you go to the website, you will find that dashboard on our website. And it's just a fantastic look every day of what's happening in Michigan. And I'll just turn this over to Mike.
Can you
talk a little more about that?
Can you call it up on your computer and share
it? Sure. Can you see that oh, hang on. I'll tell you what, we'll do that.
Well, I'll talk about it while you try. I mean, I could do it, but I figured you already have the power. Well, yeah, so I do the dashboard every day. And when the coronavirus just started, as the data guy, it was one, very anxious for all of us because of the health concerns. The data gave us an opportunity to share with readers a broader perspective. So in the beginning, you hear about 50 cases in Detroit or 100 cases in Oakland County, but we needed to put that in perspective. And once we were able to build out some maps and some charts, we were able to show people, just in a better sense where we were. And sometimes the data was just frightening when 40% of the tests were coming back positive, when we were having 200 deaths a day. Where it became helpful, I mean, I think it always was helpful, was when the things started to decline. You could see them, you could visually see them. You could see, you see at the top there's a map about the virus. So that map on the upper left, not much more than 10 weeks ago was like solid red. And I had actually had to change the scale because we went during the second wave, we went from being all blue and green, which everything's great, to dark so quickly. So when you read about a rise in cases in Wayne County, so look of 168 cases, that sounds like a lot. Well, 8 weeks ago, they were having 1,000 cases a day in Wayne. So this kind of gives you the perspective that we were in such a better position than we were. And you can look and you can see those numbers: 168, 145, 121 for 74 for Washtenaw. Well, then you go to the right and you can see that in the cases per 100,000, those are relatively low. And at the height of the second wave, I think we had 15 counties where the average cases per day per 100,000 was over 100. And that's when we had widespread infections. We had hospitalizations that were over 4,300 statewide. Right now we're about 800. So I always felt that the dashboard gave people a chance to kind of take a breath, see where we are. Let's not be fearful, or maybe in times where we didn't need to be fearful. Pulling out Detroit and pulling out Michigan, the different places, sees the perspective with where we are in the nation. That's not here. So look at the hospitalizations. I remember when they just started to rise, I'm like, one thing I found from none of the numbers moved quickly. But when they consistently start going up, they're going to keep going up. And you can see that in that second wave. And then it peaks. And then when it starts coming down, it's going to start coming down in a hurry. It's just been fascinating to watch that. And is it because of the pause that the governor implemented? Is it because people suddenly took it seriously because the cases were so high? There's a number of factors that could be there. And this is a little bit of a sidelight, but some economists told me that one of the biggest drivers of behavioral changes, more willingness to wear the mask, more willingness to stay in, was as the cases and the deaths became so much more widespread, it became more personal for people and they were able to take it seriously. Now, we've written stories. Robin wrote a great story about someone in the Upper Peninsula who had coronavirus and survived and still was a denier. I don't think that's the majority of people, because I think people did take it seriously and they did take some steps. So as you go down, so if you come back to this, and I'm going to probably rearrange some of this because right now everyone wants to know about the vaccine, and I'm sure you all do as well. Hold on a little bit, Robin. You can see that last week, the number of vaccines were down from the week before. Well, that's called a snowstorm. And it affected the production coming out of, and the distribution coming out of Moderna from Massachusetts and from Pfizer. And, you know, for the first 3 days of the week, when I don't know about where you were, but in Southeast Michigan had quite a bit of snow. Where I am, we had 19 inches on the ground. It really affected the distribution, which is unfortunate, but we are going to catch up. And we should get back to those 2 week ago levels where we were doing, I'm not putting any shots in anybody. We were doing 60,000 vaccines a day. And at that rate, we are going to catch everyone fairly quickly. And it'll probably go much higher. You know, Johnson & Johnson comes through this weekend. It's not going to be a lot of doses from them right away, but that should be added to what's already been promised by Moderna and Pfizer, and we should be seeing, you know, 80,000 to 100,000 folks. Scroll down a little bit, Robin, to the age breakdown. There we go. This is something I started doing early on, and this is one of, I mean, your population, I think the League of Women Voters skews just a little bit older. It was so fascinating early on, and unfortunately, that the deaths, people 0 to 19, yes, they've died. 20 to 29, a couple have died. 30 to 39, some have died. But when you look at 60 and above, it's 90% of the deaths. And that's why we have a policy that's putting the vaccine in the oldest population first. It is, no one is arguing with that, given what happened in the nursing homes, but even outside of nursing homes. I know my own mother, 85, with multiple comorbidities. If she had gotten it, she would not have, she probably have been in that red line, unfortunately. But she did. She's gotten the two doses, and she's good to go. Scroll down a little bit. No, you still hear me? Oh, so yeah, you can see there's some more information there on you know, you can see each county who's doing how they're doing it. You can see where the doses are shipped. School outbreaks, that was a big deal for a while. It's been less so of a big deal now. So I moved it down a little bit. I have to update that today. I see that says February 15th. But more broadly, I think the dashboard and a lot of newspapers, a lot of outlets, the Detroit, I mean the Free Press does it, MLive does it, New York Times and the Washington Post have just absolutely been spectacular. And one of the great things about looking at the national looks is Michigan's in a great place. I mean, as many deaths as we have had, and so many of them were early on when other states did not have them. Michigan is in a very solid place. I'm a little curious about a recent uptick in cases, but Michigan has a really low positive test rate. It has a fairly low, there's a test rate there. I want to point at the screen so I can point at it, but that wouldn't work, I don't think. There, that test. Well, that's fascinating. So look to the left of that chart where we had the positive, the 40% of tests were positive, and there was no testing. I've got a slide coming up. We'll show you. So what it means was there were so many cases that just were never detected because you couldn't get a test. You probably all remember that if you're sick and you don't need to go to the hospital, just stay home, presume you have it. We probably have, we're going to be on a slide, we probably have had a quarter of a million to 300,000 more cases in Michigan than were ever detected. Now we're catching almost every case. So here's the death data, which is depressing. December was not a good time. And then something I added late was there's a lag time between when they report the deaths and when the deaths actually occurred. And so the bottom one is the actual date of death. Obviously, the worst day was in April, but there in December, it was more people died in the second wave than died in the first, and it was distributed much more evenly around the state than it was the first time. That left mountain is 90%, 80% Metro Detroit. It's really unfortunate. So that's my little data dashboard thing. I will answer because I'm very interested in someone I just saw ask the chat question about the equity proposal by the Senate that wants the folks to not use race when they're talking about the vaccines. I'm appalled. I know we're nonpartisan. I'm going to be a nonpartisan appalled that they want to do that, because so many of those deaths on the left were minorities, and they died because they had we didn't understand the virus and the disease as much as we do now. They were more susceptible because of comorbidities of health, which you could argue were the result of decades, if not centuries, of systematic racism. And to suddenly say, no, we don't want to take race into account when we're doling out the vaccine, I find just appalling. The governor will absolutely veto it. And here's how much that might play into a role. Detroit was going to get 5% more vaccine than its population would have called for using these factors. And these senators don't want to use that. They just want to use age and what's the percent of people that are over 65. And if you look at it, what it does is it benefits all these counties that are rural and white, and it disadvantages a bunch of counties that have higher minority populations. I'll say it again, it's appalling. So and this is the chart I was going to tell you about. So if you look at the left, look at all the golden rod, I think that's the color. Bars are cases. And so obviously on the left, the ratio of cases to deaths is completely different than on the right. And the difference is on the right, we were testing everybody, we were identifying every case. Obviously, we've always been able to identify the deaths, but on the left, we could not. And it's just, I think a lot of states have the same situation where there just wasn't any testing. So we probably have a whole lot more people that have some natural immunity from having gotten the virus. We probably have 1 million people who have had the virus. We have another, 1.2 that have had the vaccine. So I think we should see case counts hopefully stay low. That's my dog and pony.
Okay, we are going to have some questions. Robin, did you have anything else you wanted to wrap up before we go to questions?
I was just going to say it's easy I see those, and I know Mike is the same way. You see all those data points and you see graphs, and we always keep in mind that every single one of those dots in these graphs represents somebody's misery, somebody's really, really bad time, or entire family's misery. So, and grief. So we don't lose sight of that. And that's where we want to hear from folks about what's really happening in their lives, whether it's good or bad. I don't mean to suggest it's all been bad, because there have been great stories this year too. There've been real triumphs and real moments of joy this last year too.
And one thing I want to add is about the numbers. And Robin is great at making those dots look like your neighbor, your cousin, your coworker, your family member. I have a friend who keeps talking about the small numbers. It's only this many percent of people that are going to die. The old were going to die anyways. I'll use appalling again. Like, yeah, that's right. 1.8, that's 1.8% is a small number. 15,453 is not a small number. 500,000 is not a small number. 2 million is not a small number. And it gets frustrating that people who want to go out, why can't I go to the bar? Well, go to Costco, make a story, go buy yourself a liter of vodka and go have a good time. But Jesus, this is a pandemic, and hopefully we won't have another one.
Okay, well, let's go to questions, and we've had a number on the chat, but I really did want to support people who have asked their questions ahead of time.
Okay.
Oh, we had people who sent in questions, and then we'll get to some from the chat. And I just want to say, most important thing about Bridge Magazine, folks, if you're not getting it, it's free. It doesn't cost anything. It comes to me as an email every weekday. This is one of the ones that I read from start to finish. It's easy to do, and I will full disclosure, I have been a member. I have donated for the last several years because it is just, I think it's just absolutely nonpartisan. Get both sides. Somebody mentioned about Bridge Magazine talking about Michigan sending COVID vaccines to low-income clinics to improve equity. And then right after that, I think the next day or two, Michigan GOP vaccine distribution shouldn't consider race, in quote, social justice. So it's giving the both sides without saying, even though our reporters may be saying, hey, that's, and I think most of us would be saying that doesn't sound right. But giving both sides in a positive way, not just, anyway. So first question, people 65 plus are supposed to be in the second priority group after healthcare workers, but huge numbers are still waiting to be invited to schedule. Meanwhile, new groups such as teachers and others have been added to the second priority group. Food processing and ag workers will be added effective March 1. The question is, while teachers and others are certainly all important, what is the plan for assuring that seniors truly are going second as continually shunted back by being merged into a huge and growing group?
I mean, I don't know if they are forcing them. I know there's some really serious concerns, and that is a great question. Detroit has lowered its age to 55. It's told people that suburbanites can come in and get a vaccine of any age if they'll just drive a 60-year-old plus Detroiter to the clinic. Someone I got a call, an email from someone up in Western UP saying, I can't get a vaccine for 4 counties, and they're already giving it to busboys, and I get the frustration. It is a policy decision that they say is defensible, but I don't know if obviously we want schools to open. I would agree with you there. That is a great question, because the one chart I showed you, 90% of the people who die are 60 plus. The 30-year-old might have a bad outcome, but the chances of them, and I'm not diminishing the bad outcome, the chances are so much higher of it being a bad outcome for someone older. It's a good question.
It's a great question. And we wrote the story last week about, as you mentioned, the vaccines going to federally qualified health clinics. And that's still for seniors. But the point of reaching out to those health clinics is they can make the calls to their patient load who they know don't have cars or don't have internet access. And they're still 65 years and older. That's still the eligibility for these clinics. But they are specifically trying to reach out to those seniors who have been missed already in the distribution. That's not going to fix everything. We're still trying to get people, we're still trying to reach, the state is still trying to reach all the 65-year-olds plus. But they really are to the point now where I think they're working more with local partners to say, okay, reach out. The people who no longer can work the web and come on in their car, reach out to those that need a little extra help.
Right, and another question, are there alternative processes being planned? And if so, what are they for getting the vaccine? And I think you have both spoken to that, about the different kinds of things that are happening with phone calls and so on, when people can't get online.
Mm-hmm.
Yeah, I do think because of what's going to happen in the next 2 weeks with an increase in supply, if Michigan's going to fail, it will be in the next 2 weeks. Ohio right now has vaccinated 41% of its people over 65, or over 60, and Michigan has done 37%. But Ohio's also done most of its teachers, so they were able to do both. So I don't know how they were able to do that. It's something I'm going to look at. So I think in the next couple of weeks, if that supply comes through, we are going to see a level of availability that will kind of surprise people. And I hope everyone who's on this call who's not gotten one will be able to secure one.
And I have to jump in too on one other thing. I think it's always good to keep perspective here too. It's really frustrating. We know this. I'm nowhere near being eligible yet for my shot. But the FDA authorized this vaccine late on a Friday or early on a Saturday. I mean, it was right at the end of the week, right? By Tuesday, I think it was Tuesday the next week, the first person got their shot. And it's only been what, 2.5 months, and we're at this many. This many doses. We're still short. We're still struggling. But that is an amazing public health feat. It really is public healthcare feat.
Yeah, I mean, every nursing home has been in. I think at this point has been in. A clinic has been operated in every nursing home at least once, and I think it's 80 or 90% have had the second shot. And we already know that the one shot gives you quite a bit of efficacy and safety. So. Again, I think we're going to see this ramp up in the next 3 weeks. It'll hopefully be liberating.
Okay, and I have a question for you, Mike. Why does the Johns Hopkins daily dashboard indicate the deaths in Michigan to be 600 to 800 number higher than the deaths recorded at michigan.gov/coronavirus? This discrepancy has consistently been present for many months in the first year of the pandemic.
What I'm going to guess what they do is they probably also include probable deaths. So every day, I will quietly go look on my computer, see what that number is right now. So right now, I think it's 14. It's slowly loading. Right now, there are 15,453 confirmed deaths, and there's 983 probables. So I think that what they are probably doing is I think the New York Times and the Washington Post, they're using the combined number. And a lot of those 983 probables will end up in the confirmed as they do additional reviews of the medical records. And there's now, of course, I'm pretty sure there's now post-mortem testing to identify whether the virus was in the person. So that is the difference. And some states report both numbers. But if you look at Michigan.gov coronavirus, the detail page, they will always give you both. We almost went to a bridge. We were considering at one point adding that number so that we would be in sync with some of the other ones. And then we ultimately decided not to. And I think most of the media in Michigan, for the most part, just gives confirmed. I will sometimes report there are an additional 983 probables, but that number will just constantly be there. And it's gone up. It's gone up quite a bit. It was in the 400s, I think, in November. So that number has risen. I think that's the explanation.
Okay, thank you. We have a question about resistance to masks and resistance to the vaccine. And there was a very interesting article recently in Bridge about Calumet, Michigan, and the UP, where not only were they burning their masks in a demonstration, but there's a restaurant that's very popular that has really got a lot of customers because they've lost their license to serve food, but that hasn't stopped them from serving people. And so the question is, so what is it, what can be done about that? Do you have any sense of that?
No.
I think we've all seen it. Oh, I'll let Robin go. Go ahead, Robin.
No, you're right. We've all seen it. And I will say it was really, I didn't do that particular story you're talking about out of Calumet. That was Jonathan Osting, one of our colleagues. But I spent some time in the UP, gosh, end of October, I think it was, beginning of November. And it was really, I think it's easy to shame people or criticize the folks who don't believe as we do. But look at it this way, the folks in the UP, and I think that's where a lot of the resistance comes from, or the reluctance comes from. They were hearing about COVID across the world. They were hearing about COVID in Michigan, but it wasn't affecting them. They didn't have those cases to some extent in the spring when the rest of us were dealing with it. So there was this doubt. And every day when you heard other people talking about COVID and they weren't seeing it, it doesn't seem real. Now, they since, and Mike documented it, they since had a huge wave of COVID, kill a lot of people up there. But it's, you know, it's easy to criticize, but I also do understand where some people are coming from. When it doesn't affect you, it just doesn't seem believable.
And that happened across the state because it was so rooted in lower Michigan. I've looked back at it. There were counties in Michigan that didn't have their first case until late April, and it was just one or two. So you know, they still had to wear the mask. They had to close down their schools, and you can see why they were saying, what is all this about? And up in the UP, so many of the deaths, a higher percentage of the deaths were in nursing homes. So it was almost not even real to them because it was people behind the wall. That's not, you know, but come on, aren't we all in this together? I mean, wasn't there enough proof that this was real? That's a mask. I don't get it.
Yeah, it's hard to understand for some of us, but I think an important thing that you said, Robin, and that I heard yesterday in the program that you were where you were interviewing the two health professionals is not shaming. It's people can do what they want to. And I notice even myself in the grocery store, if somebody has their mask hanging down off their face, you know, I want to say something about why aren't you? And so I said something to a gentleman yesterday. I said, your mask isn't up over your nose. And he went, oh, and he pulled it up. So just describing seemed like at least it wasn't shaming. I wasn't meaning to shame him.
Yeah, I'm sure, and a lot of us have thought about this. I mean, I think one of the symptoms of COVID, of coronavirus, even if you haven't been affected, is it's made a lot of people into, I'm going to say it, to jerks that normally aren't. And people who, you know, there's just so much anger. And so, you know, to the question of what we can do, I mean, I know it sounds Pollyanna, but honestly, just listening to people and trying to convince them without being angry, that would make 2021 already better than 2020.
That's for sure. Okay, let's see if we can get a couple more in here before you folks need to go. And then we'll take a couple from the chat. Has there been any coverage on racial differences in oxygenation tests used during COVID-19? Studies show that they can overestimate the oxygen level in Black folks, which can lead to misdiagnosis of severity and even death.
You know, I saw that story earlier this week. I can't remember where I saw that, but I did see some information on that. I have to be honest, I can't speak to that. We have not covered that, but I would love to hear more. If the person who asked the question wants to reach out, I'd love to hear more about it.
Great. And has the vaccine allocation to the state of Michigan decreased with the increase in allocation to pharmacies?
I think Michigan gets basically, because its population gets 3% of the vaccine. I don't think that number has changed. I mean, I know early on, obviously, we were trying to hit different populations, but I think proportionally that should be the same in most every state. Some states obviously are skew older, and Michigan does skew older. I'm not sure if that played a role, but I'm pretty sure it stayed pretty consistent.
Okay, Mary Ellen, do we have a question from the chat?
We do. The first question is, I have had both doses of the Pfizer vaccine and have isolated for over 3 weeks. Can I now hug my grandchildren?
That's for Robin.
Oh, I was hoping you wouldn't do that. So I have spent exactly 0 days in medical school, but I listen to a lot of really smart people. I have access to a lot of really smart people in my job. And I think what I'm getting from them is just because you haven't had the vaccine doesn't mean, woohoo, go back to normal. But certainly you do have more protection. I honestly, I would talk to a lot depends on what your other medical conditions are, but you're certainly in a much better position than you were 3 weeks ago. And there's a lot to be said about the other effects of being isolated or being cut off from family. I'd wondered though too, if, you know, your grandkids certainly haven't been vaccinated yet, but you know, what kind of their exposure is. And remember, just because you've had the vaccine, they're still not clear whether or not the vaccine protects you from getting infected or protects you from having the symptoms if you are infected. So keep that in mind too.
So checking with your own physician would be a good idea.
I would, because I think it's really gonna be a very unique situation for everybody.
Right. Okay, Linda, do we have a question from Facebook?
There are no comments or questions on
Okay,
Facebook.
all right. One more for Mary Ellen. Do we have one more from chat? That
Yes.
seems like it hasn't been covered.
Are data describing who've been vaccinated by county based on county of residence or county where the vaccination occurred?
Well, one, we have both data, but I mean, it's where you live. So, you know, when I do the numbers, it's the number of people in Washtenaw County. They could have gotten it at the DMC in Detroit. They could have gotten it in Livingston County. It's where they live.
Got it.
And that actually goes for across the state line too, because there are some people out of state who are coming into Michigan for whatever reason or getting their vaccines here. And we've written about the folks in Southeast Michigan who are jumping to go to Ohio because that's where they could get their vaccine first.
Yeah, they're sneaking down here and getting their vaccine.
Back off.
Okay, what I would suggest, Robin and Mike, before you leave, if you could put in the chat your email address, and so people could have that, because Robin and Mike really mean this, that they do want to hear from you. And with any questions, if you had a question that wasn't answered in chat that you think that they could give you some input on, would you do that? That would be good. So let me just say thanks, Robin and Mike. I know you're under deadline today, and I just appreciate you carving out this time for us because there's so many stories. And since I've gotten to know both of you, I noticed the articles that you do. So, and I'm especially, oh, here's one from Mike. Oh, here's Robin and somebody. I don't know that somebody, but I'm going to check them out. And you exemplify the quality of the work that goes into Bridge Magazine. And thanks so much to our fabulous tech team, Mary Ellen Hagenauer and Linda Williams. And it was so good to have so many of you here today. So for those of you who are watching this live, stick around because we're going to stop the recording in just a couple of minutes, and then people will have a chance to chat, talk about any possible reactions to the vaccine. I have some because I just had my vaccine yesterday. And I'm very happy about it. I only had to go 50 miles for it, so I felt very lucky. So we hope to see you folks next month for a panel of league members who specialize in health issues. Our lunch and learn is called Healthcare Reform, Improved Health for All. So check your calendar for many virtual events at lwvannarbor.org. So stay well, stay safe, and we'll see you next month when it will be spring.
Yes.
Thank you so much.
Thank you. Thank you for having us.